Welcome to In Good Shape. Coming up, taking care of a benign tumor with high-frequency ultrasound. The Pilates system of training and why it's so effective. And Ayurveda, the ancient Indian system of medicine.
Thanks for joining us. Today I'm taking you to the Gut Klostermühle, around an hour east of Berlin, next to the Polish border. This spot is well known because monks built a mill here in the 15th century. Today it's a center for Ayurveda. This is where Ketakee de Silva works. She grew up in Sri Lanka, where she worked as a doctor in the ancient healing art of Ayurveda. She learned all about herbal medicine from her grandmother, and later she studied biology.
Ayurveda is protecting health and curing sickness.
Now Mr. Silva needs to take my pulse to get a diagnosis of the Ayurvedic medicine. And this is very important because Ayurvedic medicine is about keeping balance. And then they can do some Ayurvedic medicine treatments.
According to Ayurvedic medicine, striking an inner balance allows you to live a longer, more stress-free life. Seminars in the discipline attempt to teach you to find stillness and how to build up inner power. Such courses are gaining in popularity.
Ayurveda means, Ayu means the life and Veda means the science.
Meditation is part of the program.
I went to an Ayurvedic spa on Sri Lanka 2 years ago, so I know more or less what it's about, but it tends to fade in everyday life.
I like Ayurveda because it's about the body and how you feel and how you can influence that in the way you live, what you eat, and your approach to life.
Ayurvedic theory says there are 3 bioelements or doshas: Vata or air, which is cold, Pitta, fire, and Kapha, water, which is heavy and slow. Every person, says the tradition, has a distinct mix of the 3, an individual constitution or prakriti. The 3 elements have to be in balance.
Every person has the doshas, prakriti. Like even you, your body frame, your eyes, your tongue, your speaking style, I can tell you which kind of people.
Each person is different.
Cool is the key words for you. Cool. No doubt you are very disciplined. You are the intelligent, you're supportive, caring, disciplined.
Sounds nice.
Yeah, this is, but too much is not too good.
No.
But what is the beautiful thing is, your Pitta is the dominant and Kapha is supportive. So wisely you can use your mind and heart.
Diet plays an important role in the Ayurvedic way of life. It should be adapted to the kind of constitution you have.
Each of us is predominantly either Vata, Pitta, or Kapha, and we can tailor what we eat to that. For example, my Pitta is very strong. That means I'm excitable and a bit irascible. So I shouldn't make that worse by consuming a lot of hot and spicy things.
Cook Randolph Schroeder has prepared dal and rice for supper. Then there's another round of meditation before bed.
Cooking plays a major role in Ayurvedic medicine. Why is that?
It's very, very important because we have 3 doshas. In our language we say doshas. All doshas we have to balance in our body. That's why if you come as a patient to us as an Ayurvedic doctor, after the consultation we will, very important to give the food list. That's very important. That's why every patient will get a food list. Then after you can cook at Ayurvedic to balance your whole 3 doshas and to get good healthy condition.
And what happens if you don't stick to the Ayurvedic diet? If you mix up your doshas with other doshas?
For an example, I say one patient is Pitta dosha, and he will eat always all Vata and Kapha doshas, but Pitta will go down and your Vata and Kapha go up, and it will be problem in your body. That means for an example, your constipation, you get a constipation problem and skin problem. That's why you have to always try to balance your whole tridoshas.
So otherwise it would affect your whole metabolism then, right? But there are different kind of tastes in Ayurvedic medicine, like spicy or sour or sweet. And do you have to mix it up that every patient gets every kind of taste?
Okay, you have to have this whole 6 tastes in every food. And you can have sweet, you can have bitter or herb taste. Then you will get all the three doshas in balance.
We got a viewer question from the US, California. Our viewer Karen Alborn wants to know something about the preparation of Ayurvedic food and if you can freeze it after you cooked it.
No.
You're not allowed to freeze it?
No, actually Ayurveda is always fresh. So you have to prepare all fresh.
So what about the preparation? You need a lot of time for preparing food?
No. If you really know what you want to cook, it's not, it takes not so much time. And the thing is you have to know which dosha you have, which problem you have, which kind of things you have to eat, because some foods you are not allowed to eat evening or dinner time. So that's mean fresh salad, these things you have to eat daytime or lunch. So otherwise you have to eat, you can eat everything, but it's not complicated.
Good. Even in the West, doctors start to notice that food is medicine. Here's more.
Can spices like coriander, cumin and nutmeg ease some kinds of pain, even when conventional painkillers fail? There's no scientific proof for it, but some patients say spices do make a difference. Harald Moser has rheumatism and osteoarthritis in his right hand. When the rheumatism flares up, his pain medication does make a difference. But the osteoarthritis continues to throb. He heard spices might help.
I said to myself, I want to get started right now. So I looked at what spices I had in the kitchen, and they weren't all the right ones. So I just went out and bought the ones I needed.
Now, every day, Harald takes a pinch of coriander, cumin and nutmeg.
The pain didn't disappear overnight, but I did notice that it was slowly getting better, and after a couple of weeks it was gone.
3 months after he started his spice-based pain therapy, Harald went to see his rheumatologist and told her about it. He had also stopped taking his rheumatism meds. She was astonished.
I couldn't find any evidence of inflammation in his joints. I was very interested in what was going on and said we should wait and see how his condition developed, and that I would check his joints for inflammation at regular intervals.
4 months later, Harald's pain had not returned. So can certain spices indeed help to alleviate joint pain? Are they an alternative to conventional chemical treatments for rheumatism and osteoarthritis?
I do think they have an anti-inflammatory effect and can be used to treat inflammation associated with osteoarthritis in the hands. But I must caution that I still don't consider them an adequate therapy for inflammatory rheumatic diseases.
In Berlin, we ask an expert in alternative medicine whether there have been any scientific studies of spices and their medical effects. Doctors at this hospital have been investigating spices, but not the 3 in question.
Of course, I know the spices from cooking. They're used in tasty Asian cuisine. But I also think it's quite plausible that a mix of powerful spices might serve as an anti-inflammatory.
There has been plenty of research into the effects of turmeric and ginger. Those effects have to do with certain plant compounds they contain that are known as phytochemicals.
These molecules, which are often spicy, hot, or brightly colored, have a wide range of health-enhancing effects. They tend to be anti-inflammatory or have antioxidant properties. Some of them provide pain relief.
Turmeric has helped Marianne Zerkel with her chronic joint pain. She took part in a study here about Ayurvedic medicine and osteoarthritis of the knee. Dietary prescriptions are a key aspect of Ayurvedic therapy. In the traditional medical discipline, spices don't just add flavor, they contain bioactive substances that have medical relevance.
Drawing on a wide range of spices, we treat different diseases with different agents. Certain spices are used for respiratory diseases, others for joint problems. For us, the kitchen is also a laboratory and a pharmacy.
Massage and yoga are also part of Ayurvedic medicine. The osteoarthritis in Marianne Zerkel's knee hasn't gone away, but the pain has.
I was meant to get a new knee in 2010, but I still have my old one and can walk better than before.
So for some people at least, Ayurvedic dietary principles seem to have a medical impact. Food as therapy.
Mr. Da Silva Hahn, we just talked about nutrition. Now we're here and you're doing a massage. And massage is a huge topic in Ayurvedic medicine.
Yes.
And you're even using a special table here.
This is come from Sri Lanka. I brought it from Sri Lanka. And it is made out of mahogany. It is very special for our treatments and also with oil. It's work with oil. It's for healing process. It helps for a healing process.
When you usually do in Germany a massage, you try to soften the muscles and the tendons. And this looks totally different to me here.
Ayurvedic massage is very soft massage with special herbal oils. And our big organ is in our body is our skin. And we start to open all the pores. And thereafter we try to take out all detoxifications.
What happens to all the waste products?
We will try to collect in our belly area the whole products, and then after the treatment we inform to take very special tea. It is with the herbals, and it try to flows all the products.
So strictly speaking, you just pass all the waste substances out during urination then?
Yes.
Right. You're using a lot of oil, special herbal oil, and one of those things about Ayurvedic medicine is the oil onto the forehead. So what's it for?
It is very special treatment for our head therapy or as our nerve system, and also if somebody has problem with psychology disease, and that also if you have problem with sleeping problem or a headache, migraine.
We got a viewer question from Andrea Mook, and she's interested in using the oil in her mouth. So she puts it into her mouth, and it's for detoxification, or what's it for?
Yes, it is also very, very special treatment in our Ayurvedic medicine. And you take sesame oil.
Sesame oil?
Sesame oil. You can put in mouth for 5 minutes, and you can wash your mouth with this oil. It will change some process in oil, maybe like milk, white. That you can see from out of this oil how detox.
So you can really imagine all the waste products getting out of the body with the oil as well.
True.
Yeah.
Yes.
Yeah. And there's a different method called the Panchakarma therapy.
That is the best treatment in our Ayurvedic medicine. We try to clean whole body. Panchakarma call 5 treatments. Yeah, it is purgative, vomiting, nasal cleaning. This thing I say always my patients, it's like a car. And you must make every year or every 10,000 kilometers to check up for the car.
Right.
This Panchakarma treatments is also for our body. We have also a machine in our body. It must clean.
One of the good things of In Good Shape is that we meet totally different experts in all fields of medicine all over the world. So, and if you've got any question to the experts, don't hesitate and write me an email.
In one of the next editions of In Good Shape, we're going to take a look at inflammatory disorders of the digestive tract. They can be very painful and cause diarrhea. What role does diet play in these conditions? If you have any questions about the subject, write to us. Just put enterocolitis in the subject line. We look forward to hearing from you.
One thing people like about Ayurvedic treatments is that they are non-invasive, unlike many treatments you'll find in Western medicine. Like the treatment of myoma, the benign tumors you can sometimes find in the uterus. Usually they are treated with surgery, but nowadays you can treat them with ultrasound.
2 years ago, during a routine checkup, Annetta Ruckert's physician discovered a myoma in her uterus. She hadn't noticed a thing, and at first she wasn't very worried. Myomas are also known as fibroids or fibroid tumours.
My gynecologist told me at my last appointment that the myoma would keep growing and eventually cause problems, possibly press on my bladder. She said I should do something about it.
A myoma is a benign growth of smooth muscle in the wall of the uterus. They can appear alone or in clusters. The causes aren't known, but hormones do play a role.
There are 2 main indications for treating myomas. The first is if a woman has no symptoms but might want to have children. A myoma could then prove problematic. So it's better to treat it sooner rather than later. The second is if the patient has symptoms such as bleeding or pain. Then we have to initiate treatment.
When Annetta's myoma reached 10 centimetres in diameter, it began pressing on her bladder and had to go. She had to decide what kind of treatment she wanted.
My gynecologist recommended a hysterectomy, but I wanted to keep my uterus. I feel good about my body and felt that would change if it were removed. So I looked into other treatment options.
In her research, Annetta came across a new method, high-intensity focused ultrasound, a therapy employed at a myoma centre in Frankfurt. It requires gynecologists and radiologists to work together. It's one of 4 methods currently used to treat myomas.
The first is hormone therapy, which often brings good results. The second is ultrasound. Third is uterine artery embolization, which blocks blood flow to the myoma. The fourth is surgery, which is a last resort.
After consultations at the centre, the physicians decided ultrasound was a good option in Annetta's case. Magnetic resonance imaging is used to guide and monitor the procedure. Annetta was lightly sedated. The ultrasound device is located beneath the MRI scanner. It heats the myoma to more than 65 degrees Celsius. That destroys the diseased tissue.
This method is suitable for myomas within the wall of the uterus, but not for ones that extrude. They should be no larger than 10 centimeters in diameter, and no more than 5 myomas should be treated at once.
It takes around 2 months for the body to break down all the dead tissue. A month after the procedure, Annette Ruckert's myoma had already shrunk by about half. She's now feeling good again and is relieved she chose the ultrasound method rather than surgery.
It's hard to believe how much Pilates is being hyped today in modern health clubs. I mean, it's more than 100 years old, and it's a gymnastic which stretches your muscles and trains them at the same time. But Pilates is more than just a sport. It can be a therapy.
Practitioners say Pilates is good for your back. But the method takes time to have an effect. Erich Schwemmer has been doing his exercises regularly for 4 years. The system was developed by Josef Pilates, a German who emigrated to the United States in the 1920s. Its aim is physical rehabilitation, enhancing flexibility, strength, posture and body awareness.
It has improved my quality of life. After I slipped a disc, there were lots of things I could no longer do. I couldn't run, ride my bike or my motorbike, and I had problems at work where I have to sit a lot. The slipped disc really disrupted my life, and thanks to Pilates, it's almost back to normal.
Schwemmer's orthopedic surgeon referred him to Alexander Borlander. For years, the physiotherapist has been calling for the method to be adopted in rehab programs in Germany. Standard rehab focuses on the parts of the body that hurt. Pilates, in contrast, seeks to strengthen and stretch the entire body. There are about 400 muscles in the body that ideally provide skeletal support. But if they're not used regularly, some can cease to work properly. That leads to bad posture, which in turn causes tension and pain. Under certain conditions, targeted exercise can be the antidote. Pilates trains core muscles in the abdomen and the back, a region its founder dubbed the powerhouse. Back muscles help stabilize the spine. Obliques and deep back muscles hold the flanks in place. The rib cage is like the roof of the powerhouse. Since you can't tense your abdominal muscles and breathe into your belly, Pilates teaches you lateral breathing. As you breathe out, you pull in the abdominal muscles. As you breathe in, you stretch your spine and lengthen the body. Tension and pain slowly dissipate. Pilates never trains single muscle groups, but always several together. Neck, shoulder, belly and feet muscles are closely connected. You need a mat and equipment. Josef Pilates designed it himself, including this chair. It has springs of different tensilities, so you can perform exercises of different intensity. Erich Schwemmer says after his slip disc, Pilates helped him regain strength and mobility.
Pilates is about the inner balance and keeping core strength. So why is inner balance important in Ayurvedic medicine?
Yeah, it's very important to be healthy. Otherwise, you have many problems. For an example, your digestion. And if you don't have good digestion, you will get sick.
In your home country, in Sri Lanka, Ayurvedic medicine is as important as normal Western medicine. And you're very proud about this, I guess. Yeah. And so why is it that important over there, not as important over here?
Yes, it is come from Indian, from Sri Lanka, not here in Western. And that is the thing. But the other thing is we don't do any animal tests. And, but it is still for 5,000 years old, it works.
There are a lot of skeptical people here over in the West when it comes to Ayurvedic medicine, but there are more and more people following this kind of medicine.
I'm very, very proud of them, and I'm very happy because it's the time really to work out with that and to take this really as medicine, and you can see this medicine on Ayurvedic medicine help.
I have to say, I really learned a lot today at the Gut Klostermühle Spa, east of Berlin. I learned a lot about Ayurvedic medicine, and that's a journey, a lifelong journey, and that you have to change your lifestyle, starting with nutrition and all the other things you just told us about. Thank you so much for inviting me today.
Thank you. Ayubowan, I wish you long life.
And see you next week, and try to stay in good shape. Ayubowan.